Yeah, ultimately, everything we do is about patient satisfaction. We're in healthcare, in hospitals. Patient is the reason that the healthcare system is there to be able to serve them. So everything revolves around the patient. Every technology that we're looking at, whether we're going to build it in house or we're going to partner with third party, it comes back to patient satisfaction. Our operators, those are our frontline workers, our patient dining associates, our the folks that are on the ground doing this. Everything we built is in partnership with them. We don't sell our software commercially. It's for them. We say everything is built by our operators for our operators. So we spent time on site. So that's one piece of it because they're the ones who are interacting with the patient. And if we can get that part right, that's going to lead to patient satisfaction. Then there's the patient themselves. Then there's people, we refer to stakeholders as caregivers. That's you and I. We might be providing support and care for our loved ones in the hospital. So they're interacting with the technology too. So we're considering them. And then there's obviously the hospital employees, clinical care and non-clinical care staff so all these people, they're interacting with what we do. So, but ultimately they all lead back to the patient satisfaction. So that's kind of our North Star. That's what we look at. Hey, what's going to be the impact here? Whether it's through our operators, caregivers, or hospital staff, how are we ultimately affecting the patient satisfaction?
So you've kind of solved this one problem, which was a huge problem. I think we've all dealt with it. If you've been in a hospital environment, something's missing, something's messed up, you're recalling, and just like you said, you hate to do it, but you're calling the nurse, and
Yeah.
that's just a total waste of time. I know you guys are looking to expand this platform into some other areas. Tell us about that.
Yeah, so this was definitely the first use case, but we're not done here. There's a multiple other horizons. Malnutrition, right? That's a huge use case in a healthcare environment when it comes to patient feeding. That's something that's very prevalent. So one of the next use cases that we're looking at is usually what will happen is a nurse or some other staff is eyeballing how much food was consumed by a malnutrition, um, you know, patient, and they're just saying, okay, 50% was consumed, 10%. It's very manual right now. The one of the next use cases we're working through with our partners is for there's at the beginning at the tray line before the meal is sent out. Obviously, we're able to get a view of the tray from an accuracy standpoint, but we're also able to get a view of how much food was on the tray. And then post meal consumption, as we're picking up the trays for the malnutrition patients, to quickly able to scan it to say very definitively, okay, 50%, 10%, 30% was consumed, and built a workflow around it to be able to send an alert back to via the EHR, whether it's to nursing staff, dietitian, other clinical care workers, to say, hey, it's been 3 meal periods. This patient, they've consumed, whatever the threshold is at that hospital, 50%. Someone needs to check in on them, right? Or we could be getting to a point where we have a issue. So accuracy from malnutrition.
Well, that makes total sense. Because you're looking at it now from creation to consumption. And the whole idea is to get these people fed. And as you said, the food is medicine. And so you're closing that loop on is that meal successful? Not only was it successfully deployed, it was successfully consumed. You're doing what you're doing. What really amazed me is you guys are doing this already at massive scale. The example that you provided in the nomination was 600 million meals a year for one of your customers. Walk us through kind of how operating that scale at that scale is kind of can be constraining, but you guys seem to innovate around it.